Let me tell you about something I almost didn't believe when I first read the research, decades into my career, that squeezing your hand around a soft object for just a couple of minutes at a time, a few days a week, has been shown in study after study to lower blood pressure. If I hadn't seen it work in my own patients, I might have waved it off as too good to be true. But stay with me because by the end of this, I'm going to walk you through exactly how to do it, step by step, and I'm going to share why it works. And there's one common mistake I see people make that can actually cause harm, so I'll save that for a little later. I'm Dr. James Fontaine, and for a good part of my life, I've sat across from people just like you, folks in their 60s, 70s, 80s, worried about that number the nurse reads off after the cuff tightens on their arm. High blood pressure is quiet. It doesn't hurt. It doesn't announce itself. And yet it's one of the biggest drivers of strokes, heart attacks, kidney trouble, and even memory problems as we age. We call it the silent pressure for a reason. So when there's something simple, something you can do sitting in your favorite chair while the evening news plays, something that the research actually backs up, well, I think that's worth 15 minutes of your time. The technique I'm talking about has a slightly clinical name. It's called isometric hand grip exercise. Now, don't let the fancy word scare you. Isometric just means you're contracting a muscle without moving the joint much. You're holding a squeeze, holding tension, but you're not lifting anything, not straining your back, not getting up and down off the floor. You take something soft, a stress ball, a rolled up hand towel, one of those little rubber grip trainers they sell for a few dollars, and you squeeze it at a gentle, moderate effort. Not white knuckle, not with everything you've got, just a firm, steady hold. Here's the protocol that's been studied the most, and I want you to remember these numbers because they matter. You squeeze and hold for 2 minutes, then you rest for 1 to 2 minutes, then you squeeze again for 2 minutes. You do that for 4 rounds total. So 4 2-minute holds with rest in between. And you do the whole thing 3 times a week. That's it. Roughly 12 to 15 minutes a session, 3 days a week, not every day. In fact, the rest days seem to be part of what makes it work. Now, I had a patient, I'll call her Eleanor, a retired school teacher, sharp as a tack, 74 years old. Her pressure had been creeping up for years, sitting in that stubborn range where it wasn't quite an emergency, but it wasn't where either of us wanted it. She was already on a medication, doing the walking, watching the salt, and she was frustrated. She said to me, "James, I'm doing everything right, and that top number just won't budge." I told her about the hand grip work. She was skeptical. She actually laughed at me. But she's the type who'll try anything once, so she started squeezing a rolled towel during her afternoon programs. A couple of months later, she came back, and we'll talk about her results in a bit. First, I want you to understand why on earth this would do anything at all, because when you understand the mechanism, you'll trust it more, and you'll do it more consistently. So let's talk about what's happening inside your body when you squeeze that ball. When you hold that muscle contraction for 2 minutes, you're temporarily squeezing down on the blood vessels running through that muscle. Blood flow gets a little restricted while you're holding. Then, when you release, blood comes rushing back through those vessels. And here's the beautiful part. That surge of blood flowing across the inner lining of your arteries creates what scientists call shear stress. It's the friction, the drag of blood moving along the vessel wall. Now that might sound like a bad thing, but in the right dose, it's exactly the opposite. That shear stress is a signal. It tells the delicate inner lining of your arteries, a layer called the endothelium, to wake up and get to work. And what does that endothelium do when it wakes up? It releases a remarkable little molecule called nitric oxide. Nitric oxide is one of the most important substances in your whole cardiovascular system, and most people have never heard of it. It's a signaling molecule that tells the smooth muscle in your artery walls to relax and widen. When your arteries relax and open up a little more, blood flows through more easily, and the pressure inside comes down. Think of it like the difference between water forcing through a narrow kinked hose versus flowing freely through an open one. Nitric oxide helps open the hose. Here's the thing about aging, and I say this gently because it's true for all of us as we get older, our arteries tend to make less nitric oxide and get a little stiffer, a little less springy. That's part of why blood pressure so often climbs in our later decades. So anything that coaxes that endothelium back into producing more nitric oxide is working right at the root of the problem. And when you repeat this hand grip exercise over weeks and months, researchers believe you're not just getting a temporary bump, you're actually prompting what's called vascular remodeling. The vessels adapt. They become a bit more flexible, a bit more responsive, more willing to relax on their own even when you're not exercising. You're retraining the plumbing, in a sense. You're teaching those blood vessels to behave younger. Now let me give you the numbers the research has found, and I want to be careful and honest here. Across a good number of studies and several analyses that pooled those studies together, isometric hand grip training has been associated with reductions in systolic blood pressure. That's the top number, D, in the range of about 5 to 10 points, what we call millimeters of mercury. The bottom number, the diastolic, tends to come down a bit too, though usually more modestly. Now you might think 5 to 10 points, is that a lot? Let me tell you, in the world of blood pressure, that is meaningful. Research suggests that even a modest, sustained drop in systolic pressure across a population is linked to a real reduction in strokes and heart events. This isn't a miracle, I won't sell you a miracle, but for something that costs nothing and takes 12 minutes, it's one of the better returns on effort I know of. And that's exactly why I want to pause here for just one moment. If you're finding this useful, if this is the kind of plain talk health information you've been looking for, I've put some helpful resources down in the description below to get you started. Take a look when the video's done. It's the sort of thing I'd pass along to a friend. No pressure, just there if you want it. All right, let me walk you through exactly how to do this safely, because the how matters as much as the what. First, pick your object. A soft stress ball is perfect. A rolled-up hand towel works just as well. Squeeze it lengthwise in your palm. Those adjustable spring grippers are fine too, but if you get one, start with a light resistance. The goal is a moderate squeeze, somewhere around 30% of your maximum effort. What does that feel like? It should feel like you're working, like there's steady tension, but you could comfortably keep it up for the full 2 minutes. If your hand is trembling and your face is turning red, you're squeezing far too hard. Ease off. Now here's the single most important thing I'm going to say in this whole video, the mistake I promised I'd come back to. Do not hold your breath. When people strain, their natural instinct is to clamp down and hold their breath. We call that the Valsalva maneuver, and that can send your blood pressure spiking dangerously in the moment, which is the exact opposite of what we want. So breathe. Breathe slowly, steadily, normally, right through the whole 2-minute hold. In through the nose, out through the mouth, easy and relaxed. If you can chat while you squeeze, you're doing it right. That relaxed breathing is not optional. It's central to doing this safely. So, to put it all together, sit comfortably in a supportive chair. Squeeze at that moderate, breathable effort. Hold for 2 minutes, breathing the whole time. Rest 1 to 2 minutes, shake the hand out. Then switch or repeat. Many folks alternate hands. Some do all 4 rounds on one hand, then the other on another day, and the research has used a few variations. 4 rounds total, 3 days a week, with a rest day in between when you can. You genuinely can do the entire thing during a television program, and honestly, I think that's the secret to sticking with it. Habits that ride along with something you already do are the habits that last. Now, if the hand grip isn't your cup of tea, or if arthritis in the hands makes squeezing uncomfortable, there's another isometric option that works on the very same principle, the wall sit. You stand with your back flat against a wall, slide down until your knees are bent, not down to a full squat, just a comfortable angle, higher if you need it, and you hold that position. Same idea, sustained muscle contraction, that buildup and release of blood flow, the shear stress, the nitric oxide. Studies looking at isometric exercise broadly have found wall sits to be one of the more effective options for bringing pressure down. Start with short holds, maybe 15 or 20 seconds, and build up only as you're able, and the same rule applies. Breathe steadily, never hold your breath, and if your knees or hips complain, this one may not be for you. The hand grip is far gentler on the joints for most of my older patients. Let me come back to Eleanor, my retired school teacher. When she returned a couple of months after she started squeezing that towel during her afternoon shows, her top number had come down into a range that genuinely pleased both of us. Now, and this is important, she hadn't changed anything else, but she was already on her medication and doing her walking, so the hand grip was one piece of a bigger picture. I don't want you to think a stress ball replaces everything else. It doesn't. But it was the piece that finally nudged her over the line she'd been stuck at, and more than the number, she told me she felt like she had a little bit of control back. That to me was worth as much as the reading on the cuff. And that brings me to the most important part of this whole conversation, so please hear me out. Everything I've described today is general education, not a prescription for you personally. If you are on blood pressure medication, this is a conversation to have with your own doctor before you begin, and here's why it truly matters. If the hand grip work brings your pressure down, and you're also on medication doing the same job, the two together could lower your pressure more than intended, and you could feel lightheaded or dizzy, especially standing up. That's not a reason to avoid it, it's a reason to loop your doctor in so they can keep an eye on your numbers and adjust things safely if needed. Never ever start or stop a medication on your own based on a video, mine or anyone else's. And if you have a heart condition, a recent cardiac event, an aneurysm, uncontrolled blood pressure, or any concern about strain, you need your doctor's blessing before you start squeezing or wall sitting. This is simple, but simple doesn't mean it applies to every single body without a check-in first. So there it is, one of the most quietly well-researched, no-cost, no-equipment things I know of for supporting healthier blood pressure as we age. A soft ball, a rolled towel, 2 minutes at a time, 4 rounds, 3 days a week, breathing easy the whole way through. Give the endothelium that gentle nudge, let the nitric oxide do its work, and let those vessels slowly learn to relax again. If this was helpful to you today, I've left those starter resources waiting for you in the description below. Go have a peek when you're ready and use them however serves you best. I made them for folks exactly like you. Thank you for spending this time with me. It's a privilege to sit and talk these things through with you, the way I would with an old friend across the kitchen table. Please remember that everything I've shared today is general information to help you ask better questions. It is not medical advice, and it's no substitute for your own doctor who knows your history. Talk with them before you make any changes. Take gentle care of that remarkable heart of yours. Keep breathing easy, and I'll see you again very soon. This is Dr. James Fontaine, wishing you good health.